For me, the most puzzling thing is why medicine has developed conscientious objection practices that are so different from other areas. So in the military, when people conscientiously object to military service, they have to go before a tribunal to convince them that they're a genuine conscientious objector. And then if their conscientious objection is granted, they have to perform some other service that's roughly commensurate with military service. In the healthcare professions, if someone conscientiously objects to doing part of their job, they decide for themselves, there's no tribunal, and then there's nothing they have to do to compensate the community for not doing their job. And it's very interesting to try and work out why these things are so different. Some conscientious objections in healthcare are legitimate, but we need to introduce much more rigorous standards than we currently have for allowing those. I think military tribunals work, as far as I understand, pretty well. They sort of test for the consistency of reasoning that someone has and try to determine whether their grounds are a genuine and long-standing moral concern, and I think we should do the same in healthcare. Look, I think merely by having a tribunal system we would shake out a lot of frivolous conscientious objections, because a lot of people who hold conscientious objections that are frivolous wouldn't be willing to make the effort of going before a tribunal to defend themselves, as it were. I think the important thing really is that the tribunal is willing to test everyone's conscientious objections fairly, that they're willing to try and ask them the same hard-hitting questions that we might expect in a military tribunal. So we could test for sort of consistency of reasoning. We could also ask them to say whether they really thought that this concern was more important than a patient's general right to receive medical services. And, just generally make sure that they are serious about their views, which I suspect, and other people suspect, that many people who conscientiously object are not. We as a community are under no obligation to make room for every conscientious objection, and if we find one intolerable, we don't have to tolerate it. So this is another sort of, I think, mistaken thought that you often hear in discussions of conscientious objection in healthcare. The thought that we should attempt to make room for every conscientious objection. Conscientious objectors in medicine who have views that we regard as intolerable still have an option, and that's to go and pursue another line of work.